Good afternoon, everyone. My name is McLean Bearhopt. I'm the Associate Executive Director at the network. Thank you so much for attending our net workshop today to learn more about COVID-19 vaccines and the vaccination process. We're really honored today to be joined by our friends at the Office of Mental Health Medical and Vaccine Education team. Joining us today to present will be Dr. Flávio Casoy, the Medical Director of at the OMH Chief Medical Office. We also have Matthew Canuteson, who's the Diversity and Inclusion Officer. We also have with us Dr. Sarah Kuriakose, who is the Statewide Director of Psychology Services, and Regina Shoen, the NYCPS Advocacy Specialist. They've been helping guide us over the past year in the COVID-19 safety protocols, helping us understand infection control practices, and now helping guide our community through the vaccine distribution process. And we cannot really, truly thank them enough for all their support and guidance over the past year. Their presentation today will focus on vaccine safety and effectiveness, reasons to take the vaccine, eligibility, how to get the vaccine, and engagement strategies for individuals who are vaccine curious or hesitant. After their presentation, they will answer specific questions people have. So please, throughout their presentation, feel free to type in any questions you might have in the Q&A as they're presenting, and we'll try to address as many as possible at the end. So with that, take it away.
Okay, great, folks. Let me share my screen.
Thank you, Flávio.
Yeah. All right, hopefully everyone can see my screen. So let me pass the baton to Matt Canuteson.
Thank you, Flávio. I'm Matt Canuteson. I'm the Diversity and Inclusion Officer at the New York State Office of Mental Health. We'd like to welcome people to today's webinar, learning about the COVID-19 vaccine basics and more. It's an exciting opportunity to be here talking with you all today. And we will be going through a number of slides, sharing some information, and then at the end, we are going to have an opportunity for some Q&A. Next slide, please. So first, as we already did introductions, the panelists today are myself, Matt Canuteson, Dr. Casoy, Sarah Kuriakose, Dr. Kuriakose, and Regina Shoen. And we're going to be the presenters. I'm starting off and then kicking it off to Dr. Casoy. And then again, like I said, we're going to be having an opportunity for Q&A at the end. So today's presentation, what we're going to cover is why take the vaccine, getting the vaccine. We're going to answer the question that we get, can I get the vaccine if ... And we'll be answering those questions. And then we're also going to be covering engagement strategies for individuals who are vaccine curious or vaccine hesitant. Then we're going to be following up with important facts related to the vaccine. We're going to provide you with some additional resources. And then, like I said, we're going to have an opportunity to answer any questions that you might have. Some of them we'll be able to answer right here live. And if not, we will get back to you with what the answers are shortly. Next slide. So let's kick off a poll. And I think that we have polls set up. It's set up electronically, but when you are eligible to get the COVID-19 vaccine, how likely are you to do so? 1, very unlikely. 2, somewhat unlikely. 3, neither likely nor unlikely. 4, somewhat likely. 5, very likely, have already tried to schedule or are scheduled. And 6, have already received at least 1 dose of the vaccine. And we'll give a chance for, oh, it says hosts and panelists cannot vote. That's unfortunate. I was actually about to vote. But we'll give people a chance to participate in the poll, and then we will discuss what the outcome was. So you can move to the next slide, Flávio. So now what we're going to cover is why take the vaccine. And I believe I'm turning this part over to you, Flávio.
That's to me, Matt. So thanks so much. Can you hear me?
Yes.
All right, terrific. So
Perfect.
next slide, please. Okay, so we are all facing the 1-year anniversary at this point of entering into this global pandemic together. And one of the amazing things that's happened this year is the scientific innovation that has led us to this moment where the COVID vaccines are here. The message that we want to communicate today is that you or people that you work with, your friends and family might have questions about vaccination, and that's a great thing. It is awesome to be engaged and be wondering and want to know your answers. And it's always important to educate yourself about anything, any kind of medical procedure before consenting to participate. And that applies to vaccination like anything else. Next slide, please. So what we want to do is to give you the current facts about the vaccine. We were actually frantically making some edits to our presentation even this morning based on new information that's come out. We want to answer any question that you have. I want to say thanks for the people who are already putting questions in the Q&A, super helpful. And the message that any of us who are in this position, vaccine education, want to give is, if you're still thinking, if you're still deliberating, that's fantastic. We'll keep talking to you. And it's just so important that we as vaccine educators and you as vaccine educators will just continue to follow up with people wherever they are in the process. Next slide, please. So the key message that we want to send, overarching, if you remember one thing, the COVID-19 vaccines are safe and effective tools in the fight against COVID-19. We all know that the virus is very serious and can cause severe and potentially long-lasting medical complications. And we'll talk a little bit more about some of those, the longer term risks that we are learning about from contracting COVID-19. Some people die after contracting COVID-19, and maybe many of you know people who have passed. And importantly, no one has died from getting the vaccine. That is a concern that people bring up. We will talk honestly and transparently about the side effects, but it's something to know about the differences between getting immunity from the virus versus the vaccine. Next slide, please. We also want you to remember, based on what we know from the last year, sadly, people in certain groups, groups with certain, or people with certain characteristics are at greater risk of becoming seriously ill, becoming hospitalized, or dying from COVID-19. And this does include individuals who have psychiatric disorders. We know it's particularly true with it for individuals diagnosed with serious mental illness, people who use tobacco, people who use drugs, non-prescription, and people with substance use disorders, and particularly opioid use disorder. So if you, people that you work with, people that you love, fall into any one of these descriptive categories, that's particularly important to think about that risk. Next slide, please. So number one message, the COVID-19 vaccine protects you. What a vaccine does is that it sends your immune system a message to build up the natural defenses that your body has against coronavirus. If you get exposed to the virus after you are fully vaccinated, your immune system is ready to protect you. Next slide. The second part of this is that the COVID-19 vaccine protects others as well. So it's kind of obvious that if you take a vaccine, and any effective vaccine, it's going to be a good thing for you. But people have lots of different motivations, and some people are much more motivated by what they can do to be protecting their loved ones and their community. And so important message is, if it's not super motivating for you to protect yourself, when enough people get vaccinated, we reach that threshold, herd immunity, and COVID-19 will not be able to keep spreading. And so then we will have an end to the pandemic. And by getting vaccinated, you're doing your part to protect others as well. Next slide. Finally, we get a lot of questions about, okay, what is happening with all these new strains and mutations? And an important message is that when you get the vaccine and when enough people get the vaccine, the virus is unable to keep spreading, which means that it's unable to keep mutating as fast, which means that we'll see fewer new strains and we won't have that anxiety either. So getting the vaccine is protective in so many ways. Next slide. Last message from me before passing it on to Gina. For those of you who in the last year have experienced lockdowns and restrictions and not being able to live the life that you want, taking the vaccine is the best long-term way to get to that post-pandemic world. The message really is as a society, as a community, we are in control of how long it takes to get to that post-pandemic world by vaccine uptake. And so everybody's actions do make a difference, whether it's you taking it personally or you working respectfully with people as they deliberate about the vaccine. Next slide.
Hi, everyone. My name is Regina Shoen, and I am a statewide advocacy specialist at the Office of Consumer Affairs, and I'm going to be talking to everyone about getting the vaccine. Next slide, please. So this is a really great site. It's the Am I Eligible site, and they list all of the regional hubs in New York State, and there's quite a few. It's up into the teens. So I always suggest to everyone that if you want to check a regional hub, that you check in daily, which is very important. So I was able to go on and get my husband an appointment on Monday, and he got his vaccination yesterday. And then I went on again yesterday to get an appointment at the same hub, which is in Potsdam, New York, and they are now getting appointments as far out as the 26th of March. So they will list appointments, and if there are cancellations, they even list those during the day. So you might go on, at 9 o'clock in the morning and get an appointment for 2 weeks from now, and someone else could go on 15 minutes later and get an appointment for the same afternoon if there's a big block of cancellations. It's really important to check several times throughout the day. If they say there are no appointments at your particular local hub, they may update it when there are available appointments. Another thing to keep in mind is that some of the regional hubs are restricted by residency, which means that you have to live within so many miles of that regional hub. Not all of those are restricted by residency. The one in Potsdam, New York is one of those. The one at the Syracuse Fairgrounds for the State Fair is another one. The one at the State Fair in Syracuse is operating 24 hours a day around the clock. They have the Johnson & Johnson vaccine, and that's why they're working around the clock, because it's a one-shot vaccine, so you're not going to have to return there. They're right on the bus line, so you can take a train to get there and get off the train, get on the bus and go straight to the fairgrounds. You could take a plane to get there. You could get right off the interstate if you can drive yourself. It's very close to all of those exits, and it's very well marked. There's a lot of parking. So there are many that aren't residency restricted and some that are residency restricted. Next slide, please. This is the OLAF program. So if you are a staff member or a client and are 18 years or older of the OMH, OACs, OPWDD, OCFS programs, or you live in a shelter, you can go to this link, or you can get assistance to go to this link and see if you're eligible. One of the big points about being 18 or above is that they're using the Moderna vaccine, and you do have to be 18 or above. Some of the other state sites are using Pfizer, so you could be 16 or above. Next slide, please. So this is just a screenshot of what the OLAF site looks like when you go there. And the site will ask you questions that you can answer yourself to schedule the appointment. There are many sites near major cities around New York State, and you can fill it out by yourself or with assistance, much like I helped people yesterday. Next slide. So on the day of the vaccine, you're going to have to fill out a DOH form, and there are several forms that you're going to fill out online, and they're going to either email or text you forms that you also have to fill out and bring with you prior to getting your vaccination. It's very important to remember to bring these with you. If you use the I Am Eligible and you go to one of the regional sites, you have to bring the form that they send you with you. You could take a photo of it on your phone, or you could have somebody print it out to bring with you. You have to bring a form of ID, a state form of ID as well. We ask that you don't take pain medication prior to getting your vaccine, but you can take it afterwards if you're in pain. You will wear your mask after you get vaccinated. And my husband tells me that the site in Potsdam was amazing, that you're completely socially distanced, that it runs like a well-oiled train. People are double and triple checking to make sure that everything's running smoothly. And they asked him several times if he was apprehensive or wanted any questions answered. You're going to receive the injection in your upper arm, and you do get to choose which arm you get it in. So if you have to go to work after you get the vaccination and you're right-handed, you might want to get it in your left arm. After getting vaccinated, you will be observed for at least 15 minutes for any side effects. And if you have a history of an allergic reaction, you're going to be observed for at least 30 minutes. So don't plan on rushing out, and make sure if you are working afterwards that you let your boss know that you're going to be a little while. Next slide, please. So the vaccines. There are 3 vaccines currently available in the United States. The Pfizer BioNTech, which is 2 doses administered 3 weeks apart. The Moderna vaccine, which is also 2 doses, and they're administered 4 weeks apart. And then the Johnson & Johnson Janssen vaccine, which is a single dose. All of these have similar efficacy rates. So I know some people are seeing different information, and most of it's anecdotal. I do want to say that. At your first appointment, you will be scheduled for your second dose. And if you miss your second appointment, it's so very important to reschedule with the provider as soon as you can. This will give you the maximum amount of protection from contracting COVID-19. A good example is my sister's a nurse in a nursing home. She got her first dose of the vaccine, and then she contracted COVID-19. So she missed her second vaccine. And then she waited until she was out of isolation, and she got her second vaccine. So as soon as she was out, she went and got it. The vaccines are not interchangeable, so you can't start with Pfizer and end with Moderna, or vice versa, and you can't start with Pfizer or Moderna and end with Johnson & Johnson. Big no-no. Next slide, please. The immune response. Some people report very mild or moderate reactions after getting the vaccine, and these do not mean that you're sick with COVID-19. It's just a sign that your immune system's getting ready to fight off the COVID-19 virus. And you are considered fully vaccinated 2 weeks after your final dose. I'm happy to report that last night after my husband's vaccine, all he had was a sore arm. And even then it was mildly sore. It wasn't anything he really complained about. Next slide, please. And people who do have side effects, some of the common reactions are arm soreness or swelling, slight fever, chills, tiredness, and headache. And the reported side effects are the same for all of the vaccines. I do want to note that anyone who has children or knows someone with children, these are the same side effects that pediatricians warn us to watch out for when we take our children for childhood vaccines. These are nothing new. These are the same side effects that are reported for nearly every vaccine that's given, even tetanus shots. If you've ever had to have a tetanus booster as an adult, these are the same side effects that doctors will tell you to look out for then. It's very common. Next slide, please. The 2-dose vaccine side effects. So many people do experience a delayed reaction, redness, itching, and swelling a few days after the first dose. And again, this doesn't mean you can't get the second dose, and it's not an allergic reaction, it's just a delayed reaction. And others have reported that the side effects are more common after the second dose, and they typically go away within 24 to 72 hours. So it may be helpful to schedule some time off after your second dose, or at least alert your employer that you are going for your second dose, just in case you have to call in the following day so there's coverage. Next slide. And now I believe I'm handing it off to Dr. Casoy.
Thank you, Gina. Can folks hear me? I hope so. Someone stop me if you can.
Dr.
We can.
Casoy.
Okay, great. All right, so we get lots of questions. Well, first let me say thank you everyone for attending. We're so happy to be here. Hopefully we can answer your questions and give you good information. And and just have a good conversation about this. In any case, we get lots of questions about whether or not, this person or that person can get vaccinated if. So we try to put all these questions together and just sort of address them all in one go. But feel free to ask clarifying questions if you need. So let me advance the slides here. Okay, so can I get vaccinated if I am taking oral medications, including psychiatric medications? The answer is yes, absolutely. None of the 3 vaccines interfere or interact in any way with medications, psychiatric medications or other medications. How about if I'm taking medications for a substance use disorder, such as methadone or buprenorphine or naltrexone or any other SUD medication? And it's the same thing. Absolutely get vaccinated. There's no interaction whatsoever. How about if you're actively using drugs, either sort of pills that weren't prescribed to you, or using more pills than were prescribed for you, or getting drugs or pills on the street? And the answer is yes, absolutely. You can get vaccinated. The vaccine does not interact or interfere in any way with any sort of non-prescription misuse of drugs or street drugs. So if this is something that you're dealing with, it shouldn't be a reason for you not to get vaccinated. It's okay to get vaccinated. Okay, what if I previously had an allergic reaction to a vaccine or an injectable medication in the past? There are some very, very rare cases of allergic reactions to these vaccines. To vaccines in general. So not necessarily the COVID vaccine, but vaccines in general. If you've had an allergic reaction to a vaccine in the past, talk to your doctor before getting vaccinated, because what you need to do is to take a look at which vaccine it was that you got allergic reaction to and what were the ingredients. And then compare that to the ingredient list and the FDA or the CDC website of the COVID vaccine to see if it's any of the same ingredients. Very, very likely it's not. But that's what you should do. How about if you have other allergies, such as allergies to oral medications or allergies to cats or scents or pets or bee venom or anything like that? And the answer is no problem. You can still get vaccinated. There's nothing in this vaccine that cross-reacts with something that you would sort of be exposed to in the environment or take orally. So if you've had severe allergic reactions to an oral medication in the past, no problem. You can still get vaccinated. What if you've had an allergic reaction to one of the ingredients in the COVID vaccine, and you can see those ingredients on the FDA website? Then don't get vaccinated. Make sure you talk to an allergist or you talk to your doctor, and you probably should not get vaccinated. But it depends on your particular situation and your particular reaction. And when we're talking about an allergic reaction, we're talking about anaphylaxis, a type of thing that you have to go to the hospital where they might give you, Benadryl or an epinephrine injection, like with an EpiPen. Not the types of expected side effects that we get with vaccines, like a sore arm or maybe a little bit of fever or chills. That's okay. That's your normal immune system. But if you've had like a severe reaction where you had to go to the hospital and get like an injection with Benadryl or epinephrine, that's what we're talking about. So not a problem if it's an oral medication. If you've had an allergic reaction to another vaccine or an injectable medication, talk to your doctor. If you know you're allergic to one of the components of the COVID vaccine, probably shouldn't get it. You should probably talk to your doctor about it before. Okay, how about co-occurring conditions? What if I have like a physical, like a medical problem, including like high-risk conditions such as autoimmune disorders, like rheumatoid arthritis or, things like that? The answer is yes, absolutely, you should get vaccinated. Any medical problems that you might have that puts you at risk for worse complications of COVID-19, means you should probably get vaccinated as fast as possible, especially if you're in one of these rapid eligibility groups. If you're eligible already, you should go for it. What if you're immunocompromised? If you have HIV, or if you've had cancer, or if you've had chemotherapy, or if you've had a transplant, absolutely get the vaccine, because you're at higher risk for complications if you get sick with COVID. What if you have a psychiatric condition or a substance use disorder? Same thing. As Dr. Kuriakose said, folks with serious mental illness or substance use disorder are at higher risk for COVID sickness. So getting vaccinated, is a way to keep you and others safe. And in some ways, it might be easier for you to get vaccinated, especially through the OLAV program. Every time I think of the OLAV program, I think of IKEA. Okay, what if I previously had COVID-19? You should still get vaccinated. So the immune response from the vaccine tends to be stronger than from prior infections, especially if you got sick, a long time ago, like in March or April, because the vaccines or viruses are always sort of kind of mutating a little bit. So the vaccine will protect you against new variants also. The vaccines are effective against all the existing variants that are circulating in the US. So if you previously had COVID-19, even if you have a positive antibody test, get the vaccine, because it'll protect you more. What if you currently have COVID-19? Well, once you're out of your isolation period, go get vaccinated. What we don't want are people who are still infectious to put other people at the vaccine line, the vaccinators or the other individuals getting the vaccine, at risk of getting COVID. So, finish your isolation period, make sure you're not infectious anymore, and then, it's okay to get your vaccine. What if I get COVID between my 2 doses? Like Regina said, it's sometimes that happens because, the first dose is kind of like a primer for our immune system. So you can get vaccinated as soon as you're finished with your isolation period. Even if that second injection is a little bit late, that's okay. You can still get vaccinated. What if I'm an older adult? Well, then absolutely get vaccinated, because older adults are at higher risk of COVID-19 complications. So you're prioritized now, anyone over 60, and it's a really good idea to get vaccinated. What if I'm below 18? So right now, the Moderna and the Janssen vaccines are approved for 18 and over, and the Pfizer for 16 and over. There are studies that are ongoing now to extend the emergency authorization to younger adolescents, and then after that to school-age kids. But for now, these are the age cutoffs, and that's simply a function of who was enrolled in the initial trials. So for Pfizer, it was 16 and over, and for the other 2, it was 18 and over. What if I am planning or trying to become pregnant? Absolutely, you can still get vaccinated. There's nothing in any of the 3 vaccines that will interfere with your ability to get pregnant or to get your partner pregnant. That is we are absolutely sure about that. What if you're currently pregnant, or if you're lactating or breastfeeding? Okay, so pregnant individuals were not purposefully included in the trials for the COVID-19 vaccine. But people did become pregnant while they were enrolled in the trials. And even though this was not formally studied, right, because there wasn't a specific effort to try to get folks enrolled who were pregnant, we didn't see any increased risk in the individuals who got pregnant during the trial. And the American College of Obstetrics and Gynecology, which is the big trade group for OBGYNs, recommend that vaccines not be withheld from this group. And pregnant individuals can sometimes have worse complications if they do get sick with COVID. So pregnant individuals are eligible now for early vaccination. If you are worried, or if you might have a high-risk pregnancy of any kind, just talk to your doctor. You know, there's no need necessarily to talk to your doctor, but if you're worried or if you're afraid, just talk to your OB, and that is perfectly fine. Lots of people are, and they're very good at answering these questions. Okay, so let's talk a little bit about how effective are the vaccines. So first of all, it's very difficult to say which vaccine is better than the other, because you know, they weren't compared head to head. They were studied in slightly different time periods with slightly different populations and slightly different variants of COVID in the environment. But overall, they're all extremely effective. So usually we talk about a good vaccine being about 50% effective. And these were all over 70% effective. So all three are good, effective vaccines. And they are really, really effective in preventing more serious cases of COVID where you go to the hospital or die. So, you know, the vaccines, you know, are really, really good, especially where it counts, which is preventing going to the hospital or dying. And, you know, so the vaccines will lower your risk of getting COVID. But if you do get COVID after you're vaccinated, it's unlikely, but it might happen. The chances of you becoming really sick and dying, you know, fall to virtually zero. You know, nothing in biology is zero, but it falls to virtually zero. So this is really protective against really bad outcomes if, you know, while you're sick. Is one of the vaccines better for me? As I said, they weren't compared exactly against each other. And all of them are very effective at preventing serious illness or death. Most of the time, you know, you won't have a choice because the different vaccination sites are trying to stay with only one type of vaccine because it means it's logistically easier. And also there's refrigeration issues and all that. So most of the time you won't have a choice because of logistics. But what we can say is that the best vaccine for you is the one that you can get as soon as possible. You know, because the faster we all get vaccinated, the more herd immunity we all have, and the less this virus transmits. Some exceptions, right? So if you know that you have an allergy to any of the ingredients in one of the vaccines, well, then you should probably wait for a different vaccine that you don't have an allergy to. So you just got to look at that ingredient list. If you're 16 or 17, you're limited to the Pfizer vaccine, so you got to go to one of those sites. And you know, if you're in a particular situation where it's hard to plan, you know, maybe you know, you're experiencing homelessness, or you're experiencing intimate partner violence, or you have difficulty traveling, or if you're a migrant worker, that one dose vaccine may be the best option for you if it might be hard to get that second dose. So these are things to consider. But for the most part, get the vaccine as soon as possible. That's the best one for you. Whichever one is first available, that's the one you go for. I got the Pfizer, you know, and I think my parents got the Moderna. I bet my sister is going to get the Janssen based on where they live. So, you know, we're all over. All right, so I think I'm passing the baton on to, is it Matt? Oh, Matt?
Yes.
All yours.
Thank you.
Yeah.
Thank you, Flávio. So now I'm going to talk about engagement strategies for individuals who are vaccine curious or vaccine hesitant. So some of the best practices that we want to talk about today is, one, do not wait. Viewpoints may be more difficult to change after they are formed. It also, you know, Another reason that we don't wait is that as time goes on, people have a lot more time to also access misinformation that might make them think one way or another. 2, take the time. Dedicate as much time as needed. Different individuals, how much time they're going to need and support with making the decision to become vaccinated is going to vary from person to person. It's also important that we express empathy and show respect in that we meet people where they're at. Everybody's completely different and everybody's concerns should be validated. And we definitely want to thank people for their time. And it's not really our job to try to persuade everyone, but it's definitely very important that we do validate where people's viewpoints are, because we have to remember that a lot of the fears that people have come from some very valid concerns. Next slide. Number 4 is be credible and transparent. As much as possible, include staff and clients at the same time. Share information as much as possible. Never censor information. Avoid repeating false claims. That's extremely important. If you don't know the answer to a question, be honest and say that you don't know the answer, and then take the opportunity to learn together. It's also important to acknowledge uncertainty and manage expectations. Don't over reassure. Acknowledge that some information is unknown and that some information changes. Next slide. Lastly, and this is very, very important, is role model. For people who are ready to get vaccinated, ask them to do so publicly if possible. For people who've been vaccinated, share your concerns, fears, hopes, and experience, both good and bad, before and after. That is, there's no silver bullet for, getting people to make that decision to become vaccinated, but something that we know, and the research showed us is very, very important, is the role model. That usually is one of the components that get people to make the decision to become vaccinated is, the experience of somebody that they can relate to, sharing what their experience was through the process of being vaccinated. Next slide. So now we're going to talk about some tools and strategies. And at the heart, this is about engagement, engaging individuals, and this is about information. Use strategies in your toolbox that include shared decision-making, motivational interviewing, and stages for change. And we're going to talk a little bit about them a little bit more specifically now. So shared decision-making, option grid. It might be helpful to use an option grid when you're helping an individual think through their vaccination decision. This is a partial example, and everybody will have access to the slides of a grid for Pfizer and the Moderna vaccines. It covers what do the options involve, getting the vaccine versus not getting the vaccine, as well as what are the benefits of getting the vaccine and then of not getting the vaccine. This is a tool that you can use to support people with making that decision and thinking it through the direction that they want to go. Motivational interviewing also plays an important key here and is very helpful. Some of the motivational interviewing techniques are using open-ended questions, and these help identify, explore, and understand individuals' COVID-19 vaccine concerns. Reflection statements are also very important. This encourages partnerships, deepens rapport, and broadens understanding of an individual's motivations. Affirmation statements are important. Also, ask permission to share. This puts individuals in a less defensive posture and involves them to reciprocate information being shared. You might say, "May I share my view with you?" Statements that support individuals' autonomy are also very important. Enhance an individual's sense of control and helps them feel more at ease. I want you to know this is your decision to make. Ultimately, want people to feel empowered and to understand that we are assisting them with giving them the information that they need to be able to make the decision about becoming vaccinated. And it's also important to roll with resistance, meeting individuals' resistance with curiosity, an opportunity to understand more about their perspective in a non-judgmental, respectful way, rather than confrontation, encourages continued engagement with the individual. And that's extremely important because once it does become confrontational, it's going to be very It's going to be extremely hard for you to then engage that person again at a later to then work with them on overcoming any fears or reluctance that they might have. So it's always important to kind of roll with resistance and stay with that person and hold space for their concerns. And one of the ways to do this is an example of saying things like, I'm hearing that you don't think you'll get the COVID vaccine. Can you tell me more about what is concerning you? The single best strategy is one-on-one, a non-judgmental, respectful, persistent follow-up from a trusted messenger. And this is important because, again, a lot of times people might feel pressured, they might feel embarrassed. There's a whole range of emotions that people might be going through. And that's why one-on-one is important, because it gives you really an opportunity to have a little bit more of an intimate discussion with an individual and, you know, be able to work on their concerns. Your empathy and respect are the most important factors. It's more important than knowing every single answer, but showing individuals that you understand, that you respect, and that you're just trying to give them information to be able to make the decision about becoming vaccinated. Knowing the answers to common questions will help you feel more confident and calm when engaging individuals deliberating about the vaccine. But again, we're never going to have an answer to every single question, and that is an opportunity for you to be able to, you know, enter a space and find out more information with the individual that you're working with.
All right. Thanks, Matt. You know, I think it's you know, it's really important to just to remember that, you know, for the last year, it's been really hard for everyone. You know, and I think in many ways, you know, the pressure and the urgency of getting people vaccinated might make people feel really uncomfortable or really pressured. So, no, it's really important to like be understanding and work with folks where they are. That's kind of like the philosophy that we're taking at OMH. So, you know, we try to, you know, we do these webinars at least once a week, and we try to collect the questions that, you know, that were asked, and the ones that are most frequent, we try to answer once and for all, you know, ahead of time. So hopefully we can capture, you know, any remaining questions that you have, but there will be time afterwards for more questions. You know, sorry for the typos. We try to update these all the time, and there was a bunch of new guidance that was released just yesterday. So I was updating these today. So if you see any typos or spelling mistakes, my apologies. You know, we're still digesting these, and I just made the changes to these slides. So here we go. Okay, so how do vaccines work? This is a big question that folks ask. So none of the 3 vaccines contain COVID-19. It's very important to say. There's no part of COVID-19 in any of these vaccines. What they are is a message embedded in a little piece of RNA or DNA. RNA in the Pfizer and Moderna, DNA in the Janssen vaccine, that tells your immune system what the outside of COVID-19 looks like. You know, usually when you get infected with any disease, including COVID-19, it takes a while for your body to recognize the infection and fight it. And during that time is when people can get really sick, go to the hospital, maybe even die. What the vaccine does is it just tells the body what to look out for. So when the virus comes inside you, you know, the body can start fighting it right away. And it's like the difference between a robber who robs your house and a wanted poster that shows people what the robber looks like. After that message has been communicated to your body, after the vaccine delivers the message, it's totally broken down. No part of it is left in you after a day or so. And so it's totally gone. There's no part of the vaccine that sticks around you after that message gets delivered. Okay. So, and another question we get is how do these vaccines get developed so quickly? You know, usually vaccines take longer. You know, what's the deal? Well, the science behind these vaccines didn't have any shortcuts. All the usual sort of steps were taken. Tens of thousands, over 100,000 people were involved in the trials. Why did it go so fast? Basically, it's the non-science parts. First of all, the technology used in these vaccines is not new. They've been around for a long time, decades even. So there wasn't any sort of a new science about coming up with a new technology. It was just about getting the information about COVID in this format. There was endless amount of money, and the scientists and the drug companies were able to hire a ton of people to do these trials. So there was no limitation in resources or human power to get this done, which makes a big difference. Usually you have a much smaller team that takes a lot longer to do this. Also, since sadly we had so many people sick and there was so much COVID spreading around the country, people volunteered. People really wanted to help out with this study. So basically all the volunteers signed up right away. Usually it takes months to recruit and find volunteers. Not for these. For these, it was boom, you got all your volunteers. They were all enrolled around the same time. We were able to do these studies really fast. And lastly, these vaccines jumped the queue. They jumped the line to the very front of the line for FDA review. Usually, there's a lot of products, a lot of medications, a lot of devices waiting for approval. And it takes time for the scientists at the FDA to review all the data. But this went, they just dropped everything else and focused on this, and it got approved. So so these are the main reasons: money, volunteers, staff, and FDA priority made this go so much faster. The science was totally sound. As I said, over 100,000 people volunteered to be in the trials. These trials these people were followed for several months. In other vaccine trials, we see sort of negative side effects, right away after the dose, or within 4 to 6 weeks. Even though we followed people for a lot longer than 6 weeks in these trials, no serious side effects were seen in these trials, in these participants during the trials. So that's very reassuring. So these vaccines are safe. How about after the trials ended and we started rolling out the vaccines to millions of people worldwide? Well, we have seen a handful of anaphylactic reactions, those serious allergic reactions where you have to go to the hospital. All those cases have recovered and no one has died from those anaphylactic reactions. And approximately it's about 4 to 5 cases, 4.5 cases per million doses of vaccine. So this is a very, 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 very teeny number. And it's about the same as many of our other vaccines. So this is the risk of anaphylaxis or severe allergic reactions to the vaccines is about the same as for other conditions. And so how do we compare the risk of a serious side effect against other things, that are not very common? So looking at the population as the whole and how many people won an Olympic gold medal, you are 366 times more likely to win an Olympic gold medal than you are to have a serious side effect to this vaccine. You are 666 times more likely to be struck by lightning than to get a serious side effect from this vaccine. And you are 1,000 times more likely to date a millionaire than you are to get a serious side effect from this vaccine. So the chances of getting a serious side effect from this vaccine is teeny tiny, especially compared to the risks of bad things that happen when you get sick with COVID-19. In the US, more than 525,000 people have died from COVID, and more than 2.5 million worldwide. If we think about this number in the US, that's like having a 9/11 every day for 6 months in a row. So that's very sad. And what's sad is that, we have to keep updating these numbers because these numbers just keep going up. More people have died in the US from COVID-19 than Americans died in World War I and World War II and Vietnam War combined. And just looking at a single day, right? These are big numbers, but just looking at a single day, 120 people in New York City died of COVID-19 just on Christmas Day. That's 120 families that grieved for loved ones on just one day. And this is the situation every day, right? So it's the impact has been very sad and very difficult and very heavy. Aside from deaths, about 10% of survivors of COVID, including those who only have mild illness, have what we've been calling these long haul symptoms. So fatigue, shortness of breath, pain, this thing called a brain fog, which means you're just kind of like slower and more dull, headache, depression, can last for weeks to months after the person recovers, even from a mild illness. And sometimes you have some very serious conditions that last, that really debilitate you, keep you from working, and you could even die from some of these long haul symptoms, serious heart problems or lung problems or kidney problems. Some people have even developed what looks like new schizophrenia after having COVID, these permanent psychotic symptoms. And we don't really know much about this. We don't understand why the illness does this. But scientists are desperately sort of researching and trying to figure this out and figure out how to help these people. But that's 10% of people who've gotten sick end up with symptoms like this, mostly mild, but some people very severe. Okay, one thing that we have to talk about, it's really important. I know we're getting to be a little bit over time, but we have to talk about this. There's a long history in this country where the medical establishment has mistreated, Black or African Americans, Latinx, sort of Native Americans, and other people of color, and because of this, there's a lot of mistrust in the medical establishment, a lot of mistrust in communities of color against the medical establishment. And that is totally legitimate and totally understandable. If you think about the Tuskegee Airmen experiments, the sort of failure to treat pain in African Americans, increased bad outcomes at birth in hospitals for people of color. There's all sorts of examples, endless examples of how the medical establishment sort of fails people of color. And because of this, there's a lot of distrust in this vaccine that is totally understood and totally legit. And I think it's incumbent on the medical establishment to earn the trust of people of color. So here's what I can say about this particular vaccine trial and this particular moment in history and in this particular scientific effort to treat COVID-19. There was a specific effort to make sure that African Americans were recruited and included in the studies. A lot of times the studies only recruit white people, but in this particular effort, over 15,000 Black individuals volunteered and participated in the studies. No harmful effects were found for this subsection of the study population. Many scientists and physicians of color were deeply involved in the development of the vaccine and have been encouraging people to get vaccinated. And we also know that because of all sorts of issues tied to structural racism, people of color have had higher rates of COVID-19, worse illness, more hospitalization, and more deaths than white Americans. This is tied to the deep injustices in our country, it's one reason why we really hope that people agree to get vaccinated, because it's protection, it's safety from the ravages of COVID-19. 1 in 546 Black Americans have died. 1 in 835 Latinx Americans, and 1 in 475 indigenous Native Americans have died. That's devastating. You know, and it shows how unjust our healthcare system is. What's in the vaccine? So as I said, none of the vaccines contain coronavirus. There's no way to get coronavirus from this vaccine. There's no live virus. There's no chips, no tracers. There's no way that any of these vaccines can impact your DNA or your cells. It's just a message. The Pfizer and Moderna vaccine have a messenger RNA in a little fat bubble, some sugar and salt and liquid to help stabilize it, and nothing else. The Janssen vaccine uses what we call an adenovirus, a little sort of lab-created modified virus that conveys the information to your immune system. Some sugar, some salt, and some water, and that's it. Nothing else. All of it gets broken down completely by your body after the message is delivered. None of it's left over. Okay, can I transmit COVID-19 after vaccination? So the chances are much, much lower, but it's not zero. So the vaccine protects you from getting sick, but not fully. I mean, the chances of you getting sick fall a lot. If you do get sick, the chances of you getting a serious illness or dying falls a lot. And if you do get vaccinated, the risk of you transmitting to other people falls a lot. But it's still theoretically possible. So if you live with someone who's not vaccinated and who's at risk of more serious illness, you know, you should still be very careful around them to make sure that, you know, you don't accidentally get them sick. But it is possible, even after you're vaccinated, to become an asymptomatic COVID-19 carrier. The risk falls a lot, but it's not zero. Will the vaccine protect me against new strains? So right now, all 3 vaccines are effective against all the strains that are circulating in the US that we know of. And the more people that get the vaccine, the less that virus spreads, the fewer new strains will be created. So that's really important to say. New strains sort of appear and emerge as the virus is spreading and replicating and sort of being out of control. When the virus is under better control, when there's less infection, there's less chance for the new strains to come up. So depending what new strains emerge, if we get this under control, if we vaccinate fast enough, you know, we might not have to get boosters. We might have to get boosters. We don't know yet. We're still waiting to see. And if a new strain emerges that is outside any of the existing vaccines, it's easy to update them and incorporate that new information. So, you know, and maybe we might have to give booster shots if that happens. Will I need to take a yearly COVID-19 shot? As I said, it depends on how fast the virus spreads, how fast it mutates. The faster people get vaccinated, the less likely it is that we'll need to get boosters. But the more the virus spreads, the more it's out of control, the more likely it is that a new strain will pop up that will mean that we need to get a booster. Okay, so the good news, and this is where I made my updates. What precautions should I take after vaccination? Well, this just came out yesterday, hot off the presses from the Department of Public Health, Department of Health. After you're fully vaccinated, that is, with 2 weeks after your final dose, you can gather with other fully vaccinated folks without wearing masks. So if you want to have like a house dinner party, or if you want to hang out in someone's apartment or someone's room and everyone's vaccinated, you can do that without wearing a mask, which is really great. There's fewer travel restrictions. So if you're fully vaccinated and it's been within 3 months of your last vaccine dose, so it's that window, you're fully vaccinated, but still within 3 months. When you travel to a non-contiguous state, so if you travel to California or Illinois or Florida or whatever, and you come back, you don't have to quarantine. Now, if you get sick, if you get any COVID-like symptoms, then you still have to isolate. But But this means that, you know, as people get vaccinated, their lives can begin to go back to normal a little bit. And we saw our president say that, you know, he hopes that by July 4th, people can get together for barbecues, you know, more small groups barbecue without masks as folks get vaccinated. Now, if you're out in public, or if you're with people who are not vaccinated, or if you're with higher risk individuals, we still recommend, you know, for you to do the physical distancing thing, the masks, the hand hygiene, and all that, because you want to protect them. And you want to protect people who aren't vaccinated yet. Okay, well, listen, thank you. I know that we've gone a little bit over. I want to sort of send this back to Matt and McLean and Joelle to address any other questions that we might have had.
Great, thank you so much. This was such a great hour, so informative, and I keep seeing in all the chats, everyone saying thank you. This is so helpful. So we, again, really appreciate your time and your expertise on this. We'll be making sure we are recording this, so our hope is that we can, you know, share it out with all the participants to have, and for all of you to have this information to also share and along with others who might not have been able to attend today. I mean, our goal at the network is just to be as helpful as we can by helping get out this information so that people become more comfortable in getting the vaccine and understand all the dynamics, because it is complex and it's ever moving. So maybe we could spend a little bit of time just answering some of the questions that came in while you guys were presenting. You know, one of the questions that came up was, does the COVID-19 vaccine have more adverse or increased side effects for persons taking psychotropic medications? I know you said it was safe, right? But are people seeing any, do you know if they're getting worse side effects from taking it if they're on medication?
No, it's you know, it's younger people will tend to have slightly more significant reactions than older people, but not 100%. You know, for whatever reason, you know, we expect a more intense reaction after the second dose and the first dose, but I had a bigger reaction after the first dose and the second dose, you know, so I belay the rule. So I'm youngish, but I had very limited reactions and more after the first. So if you don't have a reaction, if you don't have any side effects, it's okay. You should expect to have some mild ones, but taking psychotropics will not impact that at all.
Okay, great. I also think I heard you say you should take whatever vaccine is available. It doesn't really matter, just take what's available. Someone is asking though, should a person that's high risk wait to take the J&J vaccination?
No.
Is there any thought around? Okay.
There's no reason to, you know, they're all very efficacious. And if you have a high risk medical condition, it's the sooner you get vaccinated, the better it is, because then the sooner you get, you know, fully protected.
Right.
You know, so the only considerations, if you're 16 or 17, your only choice is Pfizer. Mm-hmm. If you know, are in like a domestic violence situation, or if you're homeless, or if it's going to be difficult to get to that second shot, transportation wise, whatever, you don't want to miss that, right? So it may be better to get the Janssen vaccine. Mm-hmm. But if you have a high risk medical condition, it doesn't matter. They're all equally efficacious.
Okay. And then similar around timing, can you be taking psych medication or diabetes medication on the day of or before the vaccine?
Yes, you can take medications, your standing medications on the day of. You know, we're not recommending that, for example, you take like Advil or aspirin ahead of time. But if you do have a little bit of a sore arm, you can take it after. You know, just because there's no need, because you might not have a sore arm, so you don't want to be taking medications you don't need to. But if you have your standing medications, just feel free to take them. Insulin, whatever, you can take them.
Okay. I don't think you covered this. Maybe you did though, in the last couple slides. Can you talk a little bit about what we know or don't know about how long the vaccine is effective for? I know there's the 90-day rule. Is there any recent studies on this about how long you're immunized? Is that the right word for?
Yeah, well, that's the ongoing study, right? That's the ongoing work. So there's a couple different things that are at play here. So first of all, the more out of control COVID-19 is in the country, the more variants we're going to see. Well, in the world, right? The more variants we're going to see, and the more variants there are, the bigger the risk of, one variant escaping the vaccine. So that's a big factor. So it's a race. It's variants versus speed of vaccination, right? So if we can get the world vaccinated fast enough, this vaccine will last longer. The other question is will the vaccine poop out, quote unquote, on its own? And we don't know that. We're watching it, but chances are it won't. And the question is, what's going to happen with the variants? Right now, all the variants in the US are covered by all 3 vaccines, but if there's continues to be mutation because it's spreading so fast, then we might have to get boosters.
Okay, that's super helpful. So it's not just about you as an individual, but it's about the race, right? To try to get as many people to try to stop it in its tracks.
That's right.
That makes sense.
Like we saw in Brazil, right? In Brazil, the north of Brazil had 2 waves of infections with 2 different variants. That was before the vaccine, right? So they thought that a lot of people got sick, and then a lot of the same people got sick again with a new variant. That was the worst case scenario. That has not happened in the U.S. But that's the fear. So the faster we vaccinate, the less we let this spread, the better the vaccines will last.
Right. Okay. What happens if you receive a dose that may not have had the proper refrigeration?
Well, I guess the worst case scenario is that it was a not effective dose. Like if there was a problem with the preservation, then it might not have worked. But if you suspect that's the case, you should talk to your local health department, or your provider, so that this can be examined. This seems like a very significant and particular situation. The great thing about the Janssen vaccine is that it's just a regular refrigerator, unlike the Pfizer vaccine, which requires a -70. Who has a -70? Nobody has a -70 freezer, So the Janssen will make things a lot easier, because it's just, you can just carry it in like a cooler in your car, and like vaccinate people.
Right.
Yeah, Dr. Casoy, I'll add just one other piece of great news on that, which is that, and obviously I echo, you should follow up with the vaccine administrator and make sure that can get sorted out. But just in terms of reassurance, even with the Pfizer vaccine, some new FDA guidelines came out at the end of February about some alternative temperatures that were okay, that initially they had said, you need this level of freezer. And then later the FDA had said, based on what we've learned, a frozen vial can be stored up to 2 weeks in a regular pharmaceutical freezer. And so, I think no need to totally panic. The right thing to do is definitely just follow up to see if you might need to get it again or whatever else your doctor recommends.
Great, thank you. Will we have herd immunity even if we do not reach the 100% of the population being vaccinated?
Well, Dr. Fauci says 70 to 85%.
Do we know where we're at in New York State? Do we have that information, or?
We do. I don't know off the top of my head. There's the state has a vaccine tracker, but I've been looking at the New York Times. And remember, we're only at phase 1B of eligibility, right? So we haven't really opened this up for the general population, so it's still low. I think President Biden says that he wants everyone to be eligible by May. So it's, I think things are going very fast. Once the Janssen vaccine production ramps up and I think it'll start going really fast.
Great. And if someone were to wait for herd immunity, would they still need to get vaccinated?
If you're eligible to get vaccinated, you should get vaccinated because that will contribute to herd immunity. Because there's going to be, people who are just going to refuse. So if you believe in the notion of viruses and the notion of how to protect other people, get vaccinated when you're eligible, because that will help us get to herd immunity sooner. It'll be your part to keep, making the world safer and letting everyone go back to normal. And you'll be able to do things like gather in, with your friends, for dinner or hang out with people, date, have relationships, all these things that you haven't been able to do for a year. Once 2 weeks after your final dose, you can gather in small groups without masks. Wow. Can't wait. And that's a big thing. And travel, I haven't seen my parents in a year.
Yeah.
So mid-April, I might be able to go see them. So I'm very excited about that.
Mm-hmm.
And Dr. Casoy, one other piece is that we kind of talked about this a little bit at the end. Herd immunity can become a moving target a little bit if we have those new variants. And again, the more people that we have vaccinated, that we could just protect against that. So hopefully that goes into some of your decision making about that.
Are there any instances, at least at this point in the process, where someone can make a choice about which vaccine they want? Or is it really like you sign up and you're just given what is available?
Yeah, so in the OLAV program, I think of IKEA every time I say that. In the OLAV program, OMH has gotten from the state just Moderna. We hope that maybe we might get Janssen at some point too, but right now we don't know. That's not in the cards. We haven't heard anything about that. So if you sign up, through that program, that's the only option we have. A lot of places just want to do one type because then they don't have to keep track of who got which one. It just makes it a lot easier for scheduling and rescheduling and stuff like that. I think Gina said that that site, that really, really busy 24/7 site in Syracuse was doing Janssen. I think you should go for whatever is closest and first available, because that'll be the easiest. And remember, they've never had a head-to-head comparison. So there's no way to compare them. We just know that when you do any of them against placebo, they're all extremely effective. There's no one who can say that one is better than the other, because they were all tested on slightly different variants.
Right.
And one thing I would add to that, if it's okay, is let's say you are talking to someone who's very hesitant about taking a vaccine. And one of the reasons is that maybe they are hesitant about one of the technologies versus the other technology, like the mRNA technology in the 2-dose vaccines versus the viral vector technology in the other vaccine. My thought there is again, 100% echo what Dr. Casoy said about really encourage people to get the one that they can get the soonest to protect themselves, to protect their community. That said, when you are working engagement with someone, if taking one versus the other is going to mean the difference between them taking anything versus them taking nothing, then that's certainly something that you can say, all right, we can call up Rite Aid versus CVS versus the hospital to figure out who's giving the one that you're comfortable with. And I think that's just a really important part of respectfully engaging with someone's preferences. And anything is better than nothing.
Yeah. Excellent point. We've seen actually a few just recently popping up where Dwayne Reed and the city have been doing these on-site, like 60 or plus for 6 people are 60 or older at some of our supportive housing residences. So that's been a new thing like in the last week. This is outside of the OMH program, but we've been encouraging people, like if it's in the neighborhood, just take it, go for sure. Someone asked a question here, a very specific one about their own experience with taking the Moderna vaccine. They had horrible palpitations, extreme nausea, vomiting after the first dose. Do you think it's still safe for them to take the second dose? Should they talk to someone about the side effects? What would you suggest there?
It's still safe to take it. It's very unpleasant. You know, my husband got similar reactions. It lasted, you know, it started about 17 hours after he got his dose, and it lasted a good 36 hours. And you know, he was very unhappy. But it was like a light switch. It went on and then it went off. And it's, you know, you're having a very strong immune reaction, which is a good and a bad thing. I mean, it's a good thing in that you have a very strong immune system. And it's a bad thing because it's very uncomfortable. Believe me, I get it. You know, he was very, very, very unhappy. You know, and that some people have that and others inexplicably don't. And it's not that the vaccine, you know, works better for one or for the other. It's that, you know, it just triggers your immune response. And that's what you do when your immune system goes all out in fighting mode. It just makes you feel real crummy. But it's not dangerous. It's just very unpleasant.
Yeah. Okay. Thank you. And I think we've covered everything except one last question, which I don't think is for this team, but William Lang, I will follow up with you afterwards, but I will raise it just in case maybe you do know the answer. You know, the weekly survey that OMH has been having people fill out, you know, like how many people they've been, you know, vaccinated, how many still would like it. It looks like it wasn't built for like the single dose option now. Do you know if they're planning to change that or update? If you don't know, that's fine. I can follow up.
I actually do know that because
someone
asked this question at this webinar yesterday. Yes, they're working on updating it. I'm not exactly sure when the update is going to be released, but it will be updated and you know, it'll be as soon as possible, I guess I'll say. As everything else in state government is, it's as soon as possible.
As soon as possible, yeah. Great. Well, thank you so much. Again, we can't extend like our whole community just really, you guys have been such an amazing support group to us and always available and taking all of our questions as they come. And we really appreciate the guidance and your time today to help our community just, you know, understand the options and the considerations of all of this and the facts. And we will make sure to share it widely. And we thank everyone for attending. So enjoy the rest of your Friday and we will talk soon, I'm sure. So thanks everyone.
All right. Thank you.
Thanks for having us.